Question 1. A client with hypertension has been prescribed hydrochlorothiazide. Which potential side effect should the nurse monitor for? A. Hyperglycemia. B. Hypokalemia. C. Hyponatremia. D. Hypercalcemia. Answer: B. Hypokalemia. Rationale: hydrochlorothiazide is a thiazide diuretic that can lead to potassium excretion, potentially causing hypokalemia. Question 2. The nurse is caring for a client who has just had a pacemaker insertion. Which nursing intervention is most appropriate? A. Encouraging the client to raise the arm on the side of the insertion site. B. Checking the insertion site for swelling, redness, and discharge. C. Advising the client to avoid using electrical appliances. D. Administering aspirin for pain relief. Answer: B. Checking the insertion site for swelling, redness, and discharge. Rationale: monitoring the insertion site for signs of infection or complications is crucial after pacemaker insertion. Question 3. Which statement made by a client with congestive heart failure indicates they understand their dietary restrictions? A. I will increase my protein intake. B. I'll avoid adding salt to my meals. C. I can eat bananas every day. D. I'll drink at least 3 liters of water daily. Answer: B. I'll avoid adding salt to my meals. Rationale: clients with CHF are typically advised to follow a low-sodium diet to prevent fluid retention. Question 4. The nurse recognizes that which lab value is most consistent with a diagnosis of myocardial infarction? A. Elevated white blood cell count. B. Decreased platelet count. C. Elevated troponin level. D. Decreased potassium level. Answer: C. Elevated troponin level. Rationale: troponin is a specific marker for myocardial injury. Its level rises within a few hours of a heart attack. Question 5. A client is prescribed warfarin therapy. Which food should the nurse advise the client to consume in moderation due to its effect on anticoagulation? A. Spinach. B. Oranges. C. Apples. D. Carrots. Answer: A. Spinach. Rationale: spinach is high in vitamin K, which can counteract the effects of warfarin, a vitamin K antagonist. Question 6. A nurse is caring for a client with aortic stenosis. Which symptom is most indicative of this condition? A. Chest pain. B. Cyanosis. C. Palpitations. D. Wheezing. Answer: A. Chest pain. Rationale: aortic stenosis can cause reduced blood flow from the left ventricle, leading to chest pain or angina. Question 7. The nurse is instructing a client on how to take their nitroglycerin tablets. Which statement indicates client understanding? A. I'll swallow the tablet with a glass of water. B. I will place the tablet under my tongue and let it dissolve. C. I need to chew the tablet for faster relief. D. I can take up to 10 tablets a day. Answer: B. I will place the tablet under my tongue and let it dissolve. Rationale: nitroglycerin is taken sublingually, under the tongue, for rapid absorption and quick relief of angina. Question 8. A client is diagnosed with peripheral arterial disease. Which assessment finding is most consistent with this diagnosis? A. Warm, flushed skin on the affected extremity. B. Pitting edema in the affected limb. C. Strong pedal pulses. D. Intermittent claudication. Answer: D. Intermittent claudication. Rationale: intermittent claudication, or pain with walking that's relieved with rest, is a classic symptom of peripheral arterial disease due to reduced blood flow to the affected extremity. Question 9. A nurse is preparing a client for a cardiac catheterization. Which statement by the client warrants further investigation? A. I had a light breakfast this morning. B. I am anxious about the procedure. C. I have had this procedure done before. D. I hope this will help my doctor identify the problem. Answer A. I had a light breakfast this morning. Rationale. Clients are typically advised to fast for several hours before a cardiac catheterization. Question 10. A client with a history of deep vein thrombosis, DVT, is to be discharged on enoxaparin. The nurse should instruct the client to monitor for which side effect? A. Dry mouth. B. Constipation. C. Hematuria. D. Insomnia. Answer C. Hematuria. Rationale. Enoxaparin is an anticoagulant. Hematuria, blood in the urine, can indicate excessive anticoagulation or bleeding complications. Question 11. The nurse is assessing a client's risk for coronary artery disease, CAD. Which risk factor is modifiable? A. Family history of CAD. B. Age over 65. C. Smoking. D. Gender. Answer C. Smoking. Rationale. Smoking is a modifiable risk factor for CAD. Interventions can be initiated to help the client quit smoking, thus reducing their risk. Question 12. Which medication is typically prescribed to reduce the risk of stroke in clients with atrial fibrillation? A. Furosemide. B. Digoxin. C. Amiodarone. D. Warfarin. Answer D. Warfarin. Rationale. Atrial fibrillation can lead to clot formation in the atria, increasing the risk of stroke. Warfarin, an anticoagulant, is often prescribed to reduce this risk. Question 13. A client presents to the emergency department with a suspected myocardial infarction, MI. Which medication would the nurse anticipate administering first? A. Morphine. B. Furosemide. C. Aspirin. D. Potassium chloride. Answer C. Aspirin. Rationale. Aspirin is an antiplatelet agent that can prevent further clot formation, making it crucial in the early management of an MI. Question 14. During an assessment, a nurse observes that a client's jugular veins are distended when sitting at a 45-degree angle. This finding is consistent with A. Right-sided heart failure. B. Left-sided heart failure. C. Dehydration. D. Hypovolemia. Answer A. Right-sided heart failure. Rationale. Jugular venous distension, JVD, is a sign of increased central venous pressure, often seen in right-sided heart failure. Question 15. A client with heart failure reports increasing shortness of breath. The nurse would expect to hear which lung sound upon auscultation? A. Rhonchi. B. Wheezing. C. Crackles. D. Stridor. Answer C. Crackles. Rationale. Crackles or rowels are heard when fluid accumulates in the alveoli, consistent with pulmonary edema often seen in heart failure. Question 16. A client is taking digoxin for atrial fibrillation. The nurse knows to monitor for which sign of digoxin toxicity? A. tachycardia. B. Hypertension. C. Yellow-tinged vision. D. Tremors. Answer, C. Yellow-tinged vision. Rationale. Yellow-tinged vision, xanthopsia, is a classic sign of digoxin toxicity. Question 17. A nurse observes an inverted T wave on a client's ECG. This finding is most consistent with A. Myocardial infarction. B. Hypokalemia. C. Myocardial ischemia. D. Atrial fibrillation. Answer, C. Myocardial ischemia. Rationale. Inverted T waves on an ECG are indicative of myocardial ischemia. Question 18. Which nursing intervention is most appropriate for a client with venous insufficiency? A. Elevating the legs above heart level. B. Applying heat to the affected limbs. C. Encouraging crossing of the legs. D. Restricting fluid intake. Answer, A. Elevating the legs above heart level. Rationale. Elevating the legs helps to reduce swelling and improve venous return in clients with venous insufficiency. Question 19. A client reports chest pain radiating to the left arm with nausea and sweating. The nurse should first A. Obtain an ECG. B. Administer nitroglycerin. C. Begin CPR. D. Administer morphine. Answer, A. Obtain an ECG. Rationale. The client's symptoms are consistent with a myocardial infarction. An ECG is essential to confirm the diagnosis and determine the severity and location of the MI. Question 20. Which diagnostic test can best determine the ejection fraction of a client's heart? A. ECG. B. Chest X-ray. C. Echocardiogram. D. Cardiac catheterization. Answer, C. Echocardiogram. Rationale. An echocardiogram provides a visual representation of the heart's chambers and can accurately measure the ejection fraction. Question 21. A nurse is monitoring a client for postural hypotension. The correct way to do this is A. Measure blood pressure after the client has been lying down, then immediately after standing. B. Measure blood pressure while the client is walking. C. Measure blood pressure after the client has been sitting, then after exercising. D. Measure blood pressure immediately upon waking up. Answer, A. Measure blood pressure after the client has been lying down, then immediately after standing. Rationale. Postural or orthostatic hypotension is a drop in blood pressure when moving from a lying to a standing position. Question 22. Which assessment finding indicates a therapeutic response to a beta blocker? A. Pulse rate below 50 beats per minute. B. Reduced chest pain. C. Blood pressure of 90/60 mm of mercury. D. Presence of pedal edema. Answer, B. Reduced chest pain. Rationale. Beta blockers reduce heart rate and blood pressure, reducing myocardial oxygen demand. This can help alleviate chest pain, angina, in clients with CAD. Question 23. A client with chronic heart failure starts to exhibit signs of digoxin toxicity. The nurse anticipates administering which medication as an antidote? A. Naloxone. B. Flumazenol. C. Vitamin K. D. Digobind. Answer, D. Digobind. Rationale. Digibind or digoxin immune fab is the antidote for digoxin toxicity. Question 24. A client is prescribed an ACE inhibitor. The nurse should instruct the client to report which side effect immediately. A. Dry cough. B. Diarrhea. C. Insomnia. D. Tinnitus. Answer A. Dry cough. Rationale. A persistent dry cough is a known side effect of ACE inhibitors and may indicate that the client needs a change in medication. Question 25. A nurse is teaching a client about the warning signs of a stroke. Which symptoms should be included in the teaching? A. Tremors. B. Sudden confusion. C. Persistent headache. D. Abdominal pain. Answer B. Sudden confusion. Rationale. Sudden confusion, trouble speaking, or difficulty understanding are warning signs of a stroke. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.